Hello, and welcome to the Science on the 7th live stream, a virtual space where we talk about topics related to air quality and health. I'm your host, Pallavi Pant, and today I am very excited to be welcoming a special guest. As you all know, this live stream is organized and hosted by the Health Effects Institute, and our focus is on air pollution and health. We try and find answers to questions related to how exposure to air pollution impacts people's health, how that's changing over time, are there better methods to do that work? And from time to time, as we work with investigators and researchers from around the world, we publish the findings from those results. And we just published a report yesterday looking at changes in children's health as a result of an intervention with school buses. Now, you might be wondering, what do school buses have to do with children's health again? And I'm here to tell you all about it with our wonderful guest, Dr. Sara Adar, who was leading the study that has just been published. Sara is a professor of epidemiology and global public health at the University of Michigan here in the US. And she also serves on HEI's review committee. So welcome, Sara. Very nice to have you here.
Hi, thanks so much for having me, Pallavi.
Amazing. So as I said, we're going to talk about your study. But before we get to that, I try and ask like a really broad question to people also to get a sense of like what's the space we're working in. And you are somebody who's worked on topics related to air quality and health for over 2 decades now. And if you were to summarize what we know about health effects of air pollution today, what would that summary look like?
Yeah, so as you've said, we've known that air pollution is bad for our health for a really long time now. Thanks for the reminder that I'm aging. But the health effects of air pollution range from really subtle things. So, for example, inflammation in our bodies to more serious impacts that we can see. So, for example, heart attacks, cancer, asthma attacks, or even dying younger than we might otherwise if we had clean air. When I talk to people about air pollution, I often think it's helpful to think about air pollution as a corollary to cigarette smoke. That's something that we know about, personal behavior that's really damaging to health. But in the same exact ways, we're exposed to, sort of the smoke that comes from industry, from power plants, and from motorized vehicles like school buses that we'll be talking about today.
Great. Thank you. So much for, highlighting some of the ways and also for bringing to mind this example of smoking, because sometimes it can be hard for people to visualize what these might look like. And recently, we also did a video on, how children in particular are impacted by air pollution. So we're going to post a link if you want to check that out later. But let's get to the topic that we want to talk about. You just finished this amazing study. It's been published now. And I think, a lot of times when people are thinking about, so if you're going to, do an intervention that links to air pollution, what does it actually mean for health? What does it mean for air quality? And I feel like your study was so interesting because it was looking at school bus replacement program in the US on children's health. So let's start with the basic question. School bus replacement and children's health. Why are we looking at that and thinking about air pollution?
Yeah, that's a great question. So as I was just mentioning, right, so vehicles in our communities are a big source of air pollution. Older buses in particular, like especially those earlier than 2010, can be very highly polluting, which means that they're not only emitting air pollutants into the air of our community, but they're also increasing the levels of exposure to air pollution for the kids in the cabins on those buses. And in the oldest buses that we have on the road, we've seen that, levels of air pollution can be like 10 times higher inside those cabins than on the surrounding roadways. And so what that means is that for kids who have really long commutes, kids who are riding the oldest buses, they can get a lot of their daily dose of air pollution, while they ride to and from school. And among those kids who are really sensitive, so those with severe asthma, for example, that can take a toll on their health and result in them, having more lung problems, missing school, and therefore perhaps not having, as strong of an opportunity to learn each day. And so, really, for all of those reasons, individual communities as well as the government has been trying to invest in replacing these old buses from the road.
Yeah, it's very interesting also because I remember when I was a kid and I went to school in a bus and sat in it for like what seemed like a pretty long time, but clearly air pollution was not on my mind then. And this idea of particularly like children's health and school buses being a source of important exposure is something that also HEI has invested in previously. So there was a report a few years ago which was doing perhaps the first part of this work, which is, what are the ways in which children may be getting exposed to, and actually not even children getting exposed, but what is coming out of these diesel buses. There's a report. So check that out. But Sarah, your study in particular, what was the question that you were trying to answer? Because it can be so broad ranging. And, then we'll go to what you found from this study.
Yeah, absolutely. So the goal of our study, which by the way was conducted in collaboration with Meredith Petty and Adam Spiro and Richard Hirth, we're all amazing scientists. Our goal was to investigate whether or not these funds that the US Environmental Protection Agency was investing in getting older diesels off of the road had measurable impacts on children's attendance at school as well as their educational performance.
Great.
Um,
So,
oh yeah, sorry, I got distracted by a chat over there. The other thing I wanted to say before we move on, Pallavi, is just that one of the things that was super exciting about this study was that we were able to ask the question using a quasi-experimental design. And what I mean by that is we were able to study it using the same techniques that, say, for example, the FDA uses when they're looking at new drug therapy. So this randomized controlled trial design. And the reason we were able to do that is because the EPA actually allocated the money. So applicants would apply, and then they used a random lottery to assign who got the funds for new buses versus who didn't. Right, and there it is a graphic of that, which really has wonderful benefits from a causality standpoint in making sure that we're really understanding the true impacts of switching out buses on our outcomes of interest.
and I'm curious because, often we have this issue of like not having the right data to answer the right problem.
Mhm.
How common is it to be able to find a question that would have this very neat data set that you can access?
I would say it is like, finding a needle in a haystack. It was such an exciting opportunity. So actually, this was Meredith Petty used to work for the EPA, and so she had heard about this. And when we were talking, boy, we got so excited. It was like a it was like a nerd birthday present of the highest magnitude.
No, and I'm very glad that you were able to identify this very neat, specific intervention that you could then also study in a very robust way. So tell us what you found. What happens if
Yeah.
schools decide to move to cleaner buses?
Yeah, it was really exciting. So what we saw was that districts, especially those with the oldest diesel school buses out there, that were randomly selected for funding, had increases in attendance for their kids and better educational performance for those children on standardized tests, as compared to those districts that were not selected for the funds. When I try and think about the magnitude of this, an example that we've tried to give is that if you took a district, let's say that replaced buses from the 1990s, they had about 10,000 kids in their district. By randomly receiving those funds, replacing their bus, they would see about 50 more kids in seats each day at school. So it's a pretty big number. And because, this was a national program, we had a lot of districts winning money. When we projected out the benefits for the program as a whole, so what we think actually were the benefits of this program, we guess that it's about $350 million of benefits each year. And that maps so beautifully against the $27 million of investment that the EPA put in over 5 years' time. So you can see that the magnitude of the benefits really outweighed the costs of getting these older buses off the roads.
Wow. I mean, I think those are, pretty impressive numbers. So about 27 million invested over 5 years, resulting in over $350 million each year.
Yeah, that's our guess. That's our best guess based on the data. Yeah.
Yeah, that's pretty impressive. So, clearly based on this work, we're seeing that replacing or even retrofitting, was retrofitting a part of the process here at all?
Yeah, so it was technically, but very, very few school districts decided
Mhm.
to retrofit. Like almost all of the districts took the money to buy new buses.
Amazing. So replacing the old buses, especially the oldest buses, just brought such meaningful improvements in school attendance and also the standardized test scores. 50 more kids attending every day is, it's a number worth taking into note. So you've been thinking about this problem for a while. You found these very useful, very meaningful results. How do you see this work, moving forward? Are you planning any follow-up studies or any other areas in which you want to look at similar problems?
Yeah, absolutely. We're always thinking about the next thing to do. One of the things that we're focusing on next is electric buses. So I think most of or many of the listeners probably know that the infrastructure bill of 2021 included like $5 billion
Mhm.
to replace diesel-powered school buses with cleaner options like electric vehicles over the next 5 years. Many districts are interested in this. There's a lot of movement happening on replacing buses to electric. But what's interesting is we actually don't have the data right now to know all that much about, say, for example, how an electric bus compares to a new cleaner diesel bus that you might
Mhm.
buy, at the same time. And so we're trying to launch some new studies, and actually, hopefully, we'll be out in the field soon to study the air quality inside the cabins of electric buses versus,
Interesting.
newer diesel buses, as well as look at, similar health outcomes of children as they switch to these different clean bus alternatives. The other thing that we're really interested in is just the way in which funds are being allocated. So, of course, $5 billion is a lot, but it's not, going to replace everybody's bus. And so, thinking about, the environmental justice issues surrounding where that money goes is another thing that we've been thinking a lot about.
Hmm. So I actually have a couple of follow-up questions because one thing that we've often heard, and I'm pretty sure you've come across this question too, is if you're trying to tell me that exposure to air pollution resulted in a health effect, how do
Yeah.
you really know this? And I feel like you've picked really interesting, very tangible health outcomes to look at. Was that a deliberate decision to focus on these types of outcomes, or what was the thinking behind that?
Yeah, absolutely. So I think that there's benefit to lots of different kinds of research. So in the past, I had done a study in Seattle, along with Sally Liu and others, where we actually were testing inside buses, and we were testing the children riding those buses, and we were getting measures of inflammation, from their exhaled breath, and we were getting, true individual level tests. And what we saw in that, along with attendance, we could see the subclinical changes that were happening to support this notion that it is indeed the air pollution, that's impacting the subclinical health that then is changing their attendance. That full picture was really helpful. Relatedly, it's like when we look at toxicology studies that are looking at diesel exhaust, for example, that all helps us to feel confident in our answers. Here, we were really trying to ask the type of question that can inform policy, that can really help the EPA, for example, to decide how to invest its money. So the fact that we found the strongest associations with the oldest buses to me was really important, because I could go to the EPA and say, hey, if you have limited resources, start with the oldest buses first. Those are the most important to get off the road. So looking at things like attendance, which has impacts on parents' ability to go to work, kids' ability to learn, kids' ability, down the road when they get jobs, to have high paying careers, like those are the types of outcomes that people listen to, but it's not without the science behind it that helps support those as plausible.
No, thank you for breaking that down. I think that's such an important piece to highlight, that you still need that foundational research that you can then build this type of work on. And I'm also curious, you mentioned you wanted to do this more with an eye towards informing policy. Are you seeing any ways in which, this work and these findings are being used already, or how do you envision this might get used for policy making?
Yeah, absolutely. I mean, I always joke with people that if I should stop working tomorrow, these studies are ones that I'll really feel like I'm proud of and that I left a legacy, because absolutely, we're talking to the EPA. The EPA, actually, when we did our first bus study out in Seattle, they invited me to the office and I gave a talk. And shortly after, I mean, I don't know that it had anything to do with me, but maybe I can tell myself, that funding was renewed. I mean, when they were working on the original bill for that eventually became the infrastructure bill, well before Kamala Harris became our vice president, her office called me and was asking about our bus study work to support, this kind of investment. So I do see it going into policy. I think it's incredibly important and incredibly rewarding. Yeah, as a scientist, I couldn't ask for more.
No, absolutely. That's very encouraging, and also really congratulations to you and all of your colleagues and collaborators on this work. I think we need this type of evidence to continue to plan for the interventions that will have the largest impacts. And I want to shift gears a bit, because I know your work is actually pretty broad ranging, even beyond school buses and children's health. And of course, children are such an important population group for us to be focusing on. They experience a lot of disproportionate effects of air pollution, but so do older people, as we know. And around the world, populations are aging. We are already starting to see in many countries more older people than younger people. And we also know now, through increasing scientific evidence, that air pollution impacts older people in a variety of ways. This is also a topic that you work on pretty extensively, especially dementia and healthy aging. So, what do we know about the effects of air pollution on older people in the context of dementia or other types of health effects?
Yeah. So it's a great question. Like I was saying early on, we've long understood that air pollution impacts our heart, it impacts our lungs, it impacts our blood vessels. And if you pause to think about it, all of those things are pieces that contribute to chronic diseases, that contribute to our ability to age with health, right? They impact our brain, they impact our physical function. And so I would say in the last, I don't know, it feels like last 10 years or so, there's really been an explosion of research trying to understand, whether or not air pollution does in fact link to things like, the brain and dementia, cognitive decline, physical disability. And I think we're really seeing compelling evidence now, that these long-term exposures to air pollution do in fact, impact our health in late life, lead to dementia, like I said, physical disability, loss of independence, which, as you noted, the world is aging. And so this has really big implications on a personal level, on a family level, right, and a societal level as we have to pay for the care of people as they age.
Yeah, I mean, I think that's probably going to be a topic that we hear more about and also pay more attention to. And if I understand correctly, you're doing work on this topic, not just in the US, but also in other countries, including in India. And I'm curious, what types of, like, do you see similar results in different places? And do you get questions, like as a scientist, what kind of questions do you get related to air pollution and dementia, for instance?
Yeah. Yeah, it's a great question. Thanks for bringing up what we call our Gateway to Global Aging study. So we are working to harmonize both outcome data as well as environmental data in kind of depends on the moment, but about 8 countries around the world right now, as you noted, including India, including Chile, countries in Europe, United States, Mexico, and look at these questions. We actually are using research that was also funded by HEI, Mike Brower and Aaron McDuffie and stuff, and they're looking at different sources of air pollution by place. And so we're trying to leverage that information to compare and contrast, exactly as you said, findings by different locations and see if it might be due to different sources that we're seeing, and sort of see where the similarities and differences are. We're currently working on our very first harmonized paper on cognitive aging and air pollution. And we are seeing some very interesting results from the US, England, India, and Chile all together. So it's exciting. We'll stay tuned for more.
Absolutely. Yeah, I'm looking forward to reading it. And also, this idea of harmonizing data sets and also looking at the same question in different locations is increasingly so important, because even in my work, a lot of times people say, well, okay, there was a study that was done in the US. What does it mean for me? And I think having these opportunities where you can look at the same question in different locations, and have that kind of compare and contrast approach would be great. So I'm very much looking forward to that research, and all the best for all the work that probably will need to go into the longer term project. But coming back to where we started, you worked on air pollution for over 2 decades now, and I'm not trying to age you. I'm pretty close to that number myself, which is surprising sometimes. But I want to go back to the time when you were perhaps thinking about what you're going to do in your career, and how did air pollution become the thing that you decided to focus on?
Yeah, it's a great question. I mean, I suppose there's probably some contribution from the fact that I'm an LA born child. So, I had the experience. We were really lucky, actually. My family lived on top of a small hill just outside of LA. And so daily I would drive from my house above the smog layer down through the air pollution and, go to school and go to grocery store and everything else I did. And it was really interesting to watch how that pollution level changed daily. When the Santa Ana winds came in, it was like, oh, we can see the islands, and then days when it was really highly polluted. So I have to imagine, that somewhat impacted what I studied for a living when I started to think about how, the environment impacts our health.
Amazing. And it's good that at least in this, time that you worked on this topic, we have seen improvements in LA and in places beyond, thanks to the work that, you and others like you have done in the US and around the world. The other thing which is more forward looking is, having done this type of work for a while, you've seen things improve, and you've seen new findings being uncovered. What is the thing that gives you hope for cleaner air in the future, for for a better, cleaner world?
Yeah, I love that question. I often joke I'm an eternal optimist, so I'm always filled with hope. I always try and look for the silver lining. And I think, this study, for example, is a perfect example of where to find hope, right? We have the ability to change our condition. We were able, or I shouldn't say we, but right, the EPA invested funds, and there were measurable impacts and probably lasting impacts to our communities and to our children. I mean, I think those are really important to note. I think it's exciting. Again, the difference in magnitude of investment versus the benefit, shows that this doesn't have to come at a an economic cost to do better. The other thing that always gives me hope, some people would say it's a bad thing, but I actually see the hope in it, is that there is no safe level for air pollution. We've never been able to find a level at which, like, your effects go away. Now, some people might be like, wow, that's terrible and terrifying. But for me, what it says is that every amount that we can reduce, right? Any difference that we can make will have a measurable impact on health and the benefits to our community. So to me, I see that as a silver lining. We're clever humans, right? People are always doing technological advances and things like that. And so it gives me hope that the more and more we can reduce, there's always going to be a benefit that we'll see.
Wow, that is a really powerful message. I think also something that I'm going to try and keep front and center as I do the work. Every step we take and every improvement we make is going to bring measurable improvement. That, yeah, I think that's really good. And what I'm taking away from this conversation is, yeah, there are on occasion ways for us to do these types of very clean studies where we can show measurable improvements. I think the numbers you shared, around 27 million invested over 5 years, resulting in $350 million of savings, that's immense. And I think also, that point about your investments do not always have to be huge in order to see those very meaningful, long lasting impacts and improvements. So, Sarah, thank you so much, both for your time today, but also for all of the fantastic work you've done, not just on this research, but other research around air pollution. It's very inspiring to see this. And also, I'm hoping and looking forward to all the amazing work you're going to continue to do in the air pollution space. And everyone listening in, thank you so much as well. We will be back on Thursday, November 7th, to talk about sources of air pollution and their links with climate change. So please join us. And in the meantime, check out our previous episodes. That's all for today. Thank you very much. And we'll see you on Thursday, November 7th. Goodbye.